Fertility can be a major concern when healing from cancer treatment. Sexual dysfunction, a lack of reproductive function, as well as a fear of intimacy are all common after cancer treatment. Don't feel alone if you experience any of these things. In this episode of Come On In, AYA Cancer Unfiltered, let's talk about all these concerns and more during Healing and Wellbeing, Fertility and Sexual Health After Cancer. It can be hard to determine when it's safe to return to normal sexual activity or when the right time to start a family is. You may be wondering, when is the right time to see a doctor about reproductive issues? Dr. Lakshmi Kondapalli, a reproductive endocrinologist and infertility expert at the Colorado Women's Center for Reproductive Health, says that some patients see her right after completing treatment.
We may readdress issues about fertility, and are there fertility treatments that we can offer to a survivor after they've overcome their cancer. I also discuss with them contraceptive concerns and contraceptive options, particularly since many oncologists advise patients to postpone pregnancy for about 1 to 2 years after completion of their therapy. So health goals that I would like patients to consider in the healing phase are, one, to really think about what their family goals are for the future and seek information about fertility options if that's something that they'd like to pursue. Two is to meet with either their primary care physician or another provider and discuss family planning contraceptive options as well. And three is really to think about their sexual well-being as well.
It's important to find your new normal sexually and reproductively after cancer. While your body heals, it can sometimes take 6 months to a year to get your period again and regain normal sexual function. And often, this isn't something that other AYAs who aren't healing from cancer can relate to. Lauren Listauskas from GRYT Health knows what it's like to navigate sexuality after the treatment phase. She offered to share her knowledge of healing after cervical cancer. Welcome back, Lauren. So, what was your experience with sexual and reproductive well-being after cancer? Did it take a while for things to go back to normal? Did things go back to normal?
Yeah, so from my surgery, I had a radical hysterectomy, and I was told not to do anything, not to be sexually active in any way, shape, or form, with myself, with others, anything for about 12 weeks. And I knew that was important to adhere to that for the healing process. And turns out I actually should have waited longer. My doctor pushed that number out to about 16 weeks based on how I was healing. And, things were mentioned to me of, maybe intercourse is going to be a little bit different. Things are going to feel different. Go slow, do this, do that. And here I am, I'm 23. And I'm like, do you think I'm really going to be aware or even know what to say to a potential sexual partner who's in their 20s? How will I ever get somebody to understand this? And they talked about things like vaginal dryness. Okay, that's fine. I'm 23. I've never bought lube. I don't know what lube to go buy. I've seen the silly Trojan commercials and KY lubricant commercials, but is that safe while I'm internally healing? What brand is good? What brand is not good? What's recommended? What's not recommended? I think another thing is not necessarily physically, but mentally dealing with, I've had these reproductive organs removed. Am I still a woman? Am I still feminine? Am I still desirable? Am I still attractive? And then the physical part of having, these scars on my abdomen, oh my God, what is somebody going to think when I take my shirt off and they see this, or if I'm going to go have sex again for the first time and have sexual intercourse, what if I do have to tell someone to stop or slow down or be more gentle? Are they going to understand? Are they going to listen? Am I going to just like freak out and start crying like in the middle of sex or something. And so, really just reassurance would have been nice, whether it was from a care team or somebody else that had gone through this, to tell me all of this is normal. You're totally not crazy for thinking it, and that my feelings were all valid.
How was returning to dating and relationships? Was it different than you thought it would be?
Yeah, I found, because I was single at the time. I didn't have a boyfriend or anything like that. And, I was, eventually meeting new people or going on dates or using dating apps, things like that. And there was always that like looming dreaded question of, when do I bring this up? Like, when do I tell them about the whole cancer thing in general? Talking about cancer, that's a very personal choice of when you share that with someone that you might be dating, and how do I even bring this up and when do I bring it up? Like, do I just say it on our first date? Do I say it when I think things are heading in a serious direction? And I think it's a really personal choice. And personally, I had it go really well when I've told people previously when I was single and about to be intimate, and I've had it go really terribly. And those terrible experiences and people who reacted really negatively or really just inappropriately or disgustingly, I ultimately got to learn, okay, this is definitely not the person for me as a sexual partner or, a partner at all for a relationship. And really, it just kind of helped me narrow things down and really showed people's true colors, honestly. But for me personally, I would kind of go on a date or, maybe the second or third date and just kind of feel things out. And if I was really getting along with the person and they seemed receptive, and ultimately, depending on my mood and how my day was going, is when I would decide how to bring up cancer. And then I always kind of just put everything up front and told them about my surgery and my side effects. If it did get down to, all right, turn the lights off and, we're gonna be intimate with each other, just kind of reiterate the information that is really important, because the last thing you want to do is hurt yourself or get yourself in a bad situation or be in an intimate relationship and somebody not listen to you. It's already kind of a taboo subject, right? Like talking about sex, you just don't do that. You're taught to not do that. Well, as young people, we should be talking about it. And it's totally normal. It's a huge part of human nature and human life. And you should really feel safe in those sexual interactions you're having with people. And you want to be safe too from a medical standpoint, and any things you should be worrying about, even when it comes to contraception or condoms when you're, going through chemo. It's not just you're looking at implications possibly to your partner too, and keeping them safe and keeping them healthy. And, I think it needs to be talked about.
Do you have any tips for discussing sexual problems with the people around you? Maybe you need to explain it to your caregiver so they can support you, or a friend asks an awkward but well intentioned question?
Right. Yeah. And I think you make a great point. Like, I'm not out here talking to my dad and confiding in my dad about my dry vagina and sex hurting. Like, I'm just not. And I think when it comes to sharing side effects or sharing implications or even just general disease education and awareness, something that I have found, if you think it's going to be uncomfortable or embarrassing to talk about like face to face, or, even if it comes to people asking you questions and you're like, I don't want to answer this right now. I have found for me, something I like to do is like a text message of, hey, remember when you asked me about this? Or, hey, this is kind of what I have going on. I found an article or I found a blog or a podcast or something. And I think this is going to help you understand what I'm dealing with right now. It would mean a lot if you listened to it or read it. And so then you're kind of taking the pressure off yourself. And if this person is truly interested in your well-being and your healing, they are going to take the time to look at this. Or whether you give them the printed handout from your doctor's visit that explains your cancer or explains a side effect you're dealing with. There's ways to go about that I think can take the pressure off and make things a little bit easier. And ultimately, the people that care about you and love you and want the best for you are genuinely going to want to take the time to get to know what you're going through because they do want to help you.
We've talked about your organization, GRYT Health, before. How can GRYT Health help AYA patients during the healing and well-being phases?
Yeah, so at GRYT Health, we offer a variety of different things during, someone's survivorship. We consider you a survivor the day you're diagnosed because you're already surviving it. And we offer, peer connection. That's one thing, whether you're coming and joining our casual meetups on Zoom, meeting other people, hearing from other people, realizing that you're truly not alone. We partner up with a lot of different nonprofit organizations and share their resources. That's one of the things I do a lot is somebody saying, hey, I need help with this and I don't know how to find the help or where to go for the help. Well, I'm going to help you get there. I'm going to go and find the links. I'm going to find the financial assistance applications. I'm going to find the fertility grants, and I'm going to help you find all that so that you can get to where you ultimately want to be in your survivorship. And we also have a lot of educational content and programming. So, maybe you want to get genetic testing done, but you're kind of scared or you're worried or you are even wondering what the heck it's going to be like your first appointment with a genetic counselor. Is this, hereditary, or is it something just in my body? We have educational information on genetic testing. We spell out what it's like to be in a clinical trial and really just hit on these topics and these things that are relevant in healthcare today.
Thank you, Lauren. It didn't come up during the interview, but the cancer Lauren had, cervical cancer, can actually be prevented. That's because up to 90% of cases are caused by a virus called HPV, a virus you can get vaccinated against. And HPV can cause more than just cervical cancer. It can also cause vaginal, vulvar, penile, anal, and oropharynx, or throat cancer. HPV vaccines are routinely given to both boys and girls aged 9 to 26. Unfortunately, the same year Lauren was eligible to receive the vaccine, her provider never recommended it to her. That left Lauren at a greater risk of developing HPV than other people her age. Lauren is an advocate for young people to get vaccinated against HPV. There are very few vaccines that can help prevent cancer, and this is one of them. Having cancer once already increases your chances of having cancer again. Don't risk it. If you don't think you've received your HPV vaccines, ask your doctor to look through your vaccination records. The CDC assures that all inactivated vaccines, including the HPV vaccine, are safe to receive during and after cancer treatment. Fertility after cancer can be a difficult hurdle. So if you're considering having kids, or just want to keep your options open, reproductive endocrinologist and infertility expert Dr. Lakshmi Kondapalli has some suggestions.
I would advise patients to consider identifying what their current fertility status is. They can get information from their primary care physician or seek a fertility specialist to really see and assess what their long-term impact has been of their cancer treatment on their fertility.
Once you've identified your fertility status, it's important to determine your options for starting a family, if that's what you want. If you took measures before starting cancer treatment, you may have more choices about how to start a family safely and effectively.
If a patient has pursued fertility preservation methods prior to their cancer therapy, the well-being phase may be an opportunity for them to actually utilize some of their banked eggs or embryos or even sperm. In that setting, I would advise for my female patients to follow up with their obstetrician. And for some of my patients, I recommend seeking the advice and consultation of a maternal fetal medicine doctor. These are doctors that specialize in high risk obstetrics and really specialize in thinking about how do patients that have a whole host of medical illnesses, how can pregnancy be safe for them?
However, if you didn't preserve your fertility beforehand, defining your fertility is still important and will determine the options you have available to you.
If the patient's in the healing phase and hasn't had a conversation about fertility preservation options, I approach that patient by discussing with them their current fertility status. There are a number of things that I can provide in the form of blood tests or special types of ultrasounds for my female patients, or for my male patients, something as simple as a semen analysis to really assess what their current fertility status is now in the setting of their cancer healing phase.
Mallory Casperson and Lauren Creel of Cactus Cancer Society know firsthand what oncofertility entails after cancer. They both decided to focus on their fertility after the treatment phase. Together, they have some great advice for patients in the healing phase who are looking to understand more about their family planning options. Hello! So tell us about your oncofertility history. Were you offered fertility preservation before cancer treatment?
So, yeah, I was very fortunate during both of my diagnoses to be offered access to fertility preservation. I guess access is not quite the right word, though, because access also entails being able to pay for said thing. And I'm not sure I would have been able to do that 10 years ago. But oncofertility has also like evolved a lot in the last 10 years. So when I was diagnosed the first time, fewer procedures were really sort of available to me compared to now. Fewer interventions, that's the word that I was looking for. So both times that I was diagnosed, I talked to a reproductive specialist and decided not to preserve my fertility. I really wanted to expedite getting rid of the cancer and not allowing it to progress in any way, shape, or form. But then it became this giant stressor in between my two diagnoses. When I went to my first care team and like really pushed on them to tell me more about this, they had very little to say. Like the data is just really lacking in this department. So Lauren and I really connected around this idea of like, we know that we've done damage to our bodies, but we might still be fertile, but we might be infertile and we don't know. And actually both joined a study that tried to help like validate some of this information.
You're currently undergoing IVF, is that correct? How's that been going for you?
When my son, so I have a 3.5-year-old, and when my son was 1 year old, we started trying to conceive a second child, and I relapsed basically like in that same period of time. So when I was going through cancer treatments, I just felt myself getting older. And now this idea, my brother and I are 9 years apart, and so I just have really always wanted children who are closer together, which is just also part of this idea that cancer throws so much of what one expects from one's life up into the air and jumbles it around. And so part of my new normal post the second diagnosis has been really grieving this idea that I had before, that I would have two children, hopefully, or more, and that they would be closer together. And that really got squashed. And so when I finished treatments, I this was literally a conversation I had with my oncologist. Like last time I was told to wait 5 years. I just want you to know I'm not going to do that. So what's your next best thing? And she's like, well, I think maybe wait at least 2.5. And I was like, so I don't think that's going to work for me either. What's your next best idea? So we sort of settled on this idea that I would like wait at least 6 months post cancer treatments ending, give my body a little time to rejuvenate itself a little bit to recover, and then we could start trying again. And so fast forward a little bit of time now, just things weren't working, so we moved into IUIs and then IVF. And I think one of the things that's hard about sort of gauging how IVF is going is it's not going well until you've gotten pregnant. But we're we're sort of problem solving at the moment, which I find a little frustrating. Yeah, so it's going okay. I feel very comfortable with the team that I'm working with, which I think is important for cancer treatments and everything else that we face in the medical world. But we've also been at it for a little while now and it's not working yet. So we'll just see. We'll just see. And I think part of the grieving process and part of going through IVF is and part of going through cancer is just this idea that we don't always have a lot of control over what is happening. And so I feel like half of the new normal battle for me is just understanding that.
Lauren, you also have experience with oncofertility, right? Do you have anything to add?
Yeah, so for me, I was lucky enough to be offered fertility preservation when I was diagnosed, but I did not go through with that. It was a very weird conversation because I was 23 and an adult, and my parents were also in the room when it was offered to me. And my dad's response was like, "No, we're not doing that. Like, we need to start treatment ASAP." And I had to kind of take a moment and be like, whoa, whoa, my fertility is important to me. I want to take a moment to think about it and to talk through it. And then after talking through it further with my oncologist, she didn't think that it would have a huge impact on my fertility, the specific treatments that I was having. So I decided not to go through with it. There's just so much unknown that comes when it comes to fertility and cancer treatment. And I had no idea if I was going to be fertile or not. And I think the biggest piece of advice that I would give to cancer patients who are thinking about this and are concerned about it would be to go get tested. I didn't know that I could get fertility tests or who to go to, and really that any of that was available to me. So I just lived in this period of uncertainty, which was really weird when I, started dating someone seriously and had to have this conversation about, I don't know if I can have kids or not. And is that okay with you? Even though we've only been dating for a month, So I would say go talk to a reproductive endocrinologist. They are the ones that can do all of the testing that you need, and they can help you to answer those questions.
And an OBGYN can often make a referral, because sometimes having that word referral is really a magical thing in the medical establishment and can help expedite seeing that person a little bit sooner.
Well, and I think another thing that people don't really know, like I didn't have my eggs freeze before I went through treatment, but if I wasn't married now and I still wanted to have kids, I could have them freeze now.
Mm.
I don't think a lot of patients think about, that aspect of survivorship, that those options can often still be available to people. And then I think another piece of advice would really be if you are interested in going through fertility treatments, to seek out financial support for cancer survivors, because there is some available. Mallory mentioned that I think egg freezing and embryo freezing is supposed to be required by insurance in California. Is that what you were saying? But a lot of
Yeah,
times,
the retrieval process, the preservation process.
the preservation process.
Yeah.
Some states are beginning to require that that's covered for cancer patients, but the piece after it, the IVF and the IUI, those aren't covered. So to go and seek out some financial resources, because those are available.
And I think too, there are a lot of ways to build a family. And so if having biological children of one's own isn't the thing that's most readily accomplished, then there are other options. And so, but I think that's part of a grieving process a lot of the time too, of just knowing that there are other avenues and then moving forward in those other ways.
Thank you. To finish this episode, we'd just like to ask you, you both are in the well-being part of your cancer journey. Where do you hope to be 10 years from now?
Yeah, I hate that question. But no, even I feel like I'm 30, right? And people ask that in general, like, where do you see yourself in 5 years, 10 years? And it's hard at this age in general, but then you throw a cancer diagnosis on it and you throw on, me being 30 and my mom dying from cancer, and it really kind of twists things and makes you really, really think about it. And for me, professionally, I definitely still want to be helping people in some capacity in the healthcare space. And really, at GRYT Health, I get to share my own experience and truly help other people and see the changes in them and see them get to where they want to be. And so I definitely hope I'm still doing something professionally along these lines, wherever I might be. And personally, I really just hope I'm still just pushing through and surviving and making the most out of what my life is today. Sure, it's not what I imagined when I was 15, what 30 would look like. Or, when I was 20, what I thought this would be like 10 years from 20. And ultimately, I really just try to go with the flow. I say it in a positive way and I say it in a negative way. It depends on the situation, but I always lean in on it is what it is. And it's my choice to make the best of it, or, let it really get to me and be the worst.
I hope that in 10 years, they've all already heard of us, because psychosocial care is that well integrated into the clinical setting that that's not part of the hustle that we do ourselves. Because I think that's still missing from so much of the oncology conversation, is this idea not just of curing patients and setting up a monitoring schedule and a side effect management schedule that works for people, but also helping manage that whole rest of the person who is going through this very, very life-changing thing. And so a lot of the work that we do right now is just advocating that psychosocial care is so important and should be part of the default piece of the establishment, part of the default piece of care. And it's not always, even in very well-respected oncology institutions. So I think that's what I would hope.
Our goal at Cactus Cancer Society is to reduce isolation among young adults with cancer. And I think that's some of the value of this podcast as well, is, we're sitting here saying you're not alone in what you're feeling. So I think my goal for people in 10 years is that they would know that they're not alone in this, that they would find other people who are going through it and really build strong connections and community with one another.
And that concludes this episode. We appreciate you joining us. On the next episode, we wrap up with the well-being phase and go over nutrition, exercise, and independence. Tune in to Healing and Well-Being, Preparing for the Future for more information. Appreciate the strength and resiliency you've built this far. As Dr. Kondapalli said, this is the one thing you have complete control over. You can choose if you want to have a family and how that happens. The future and who you choose to spend it with is your decision. Good luck, and see you next time. This has been Come On In, AYA Cancer Unfiltered, a podcast for patients 15 to 39. This podcast was produced by Reimagine Well with funding by 70K. Our creative producer is Emma Grace Eisenman with video production by Sedona Cruz. Our creative director is Roger Holzberg. Our content supervisor is Adele Sender. Our project manager and coordinator is Pamela Primessa Karstens. Our social media manager is Sedona Cruz. Our social media intern is Ryan Meglino. Script by Emma Grace Eisenman, based on the Adolescents and Young Adult Cancer and Oncofertility Guides by Reimagine Well. Audio editing by Emma Grace Eisenman. Video editing by Sedona Cruz. Additional audio and video editing by Graham Karstens. Digital artwork by Ray Jameson. Graphic design by Sarah Gray. A big thank you to our medical experts, Dr. Leonard Sender, Dr. Lakshmi Kondapalli, Jocelyn Harrison, RDN, Ginny Urikel, MSW, and Debbie Wagers, CCLS. Our guests for this episode were Johnny Immerman of Closed Talk and founder of Immerman Angels, Mallory Casperson, MS, co-founder and CEO of Cactus Cancer Society, Lauren Creel, MSW, NPH Chief Operations Officer of Cactus Cancer Society, David Craig, CEO of GRYT Health, and Lauren Listauskas, Vice President of Community at GRYT Health. Stephen Giolarakis, President of the Stephen G. Cancer Foundation, Angela Giolarakis, PhD, founder of the Stephen G. Cancer Foundation, and Blake Dirksen. Thank you. This podcast is possible because of you. I've been your host, Marie Sad, and thank you for listening.